So this will cover physical, cognitive, and socio-emotional development in late adulthood, which is approximately age 60 or 65 through the end of life. In some cases, we have broken it up a little bit, this age group. Some sources and readings and things might say older adults versus oldest adults, which would break up like the 60 to 80 and the 80 and above range. But generally speaking, this is 60 and above or 65 and above. Pretty much longevity is our lifespan, right? The maximum number of years an individual can live. Here in the US, we're hovering right around 80, uh, 80 years for our life expectancy. Females are slightly longer, 81, males slightly shorter, 78, 79. So we're right around there. Um, the oldest or longest life expectancy in the world is out of Hong Kong and Japan. They're on average right around 85, with females at 88, males at 82 or 81. If we look at some of your European countries, Switzerland, Italy, they're also high. They're around 84 on average. If we go into Asia, South Korea is at 83. Um, Back into Europe, we see Iceland at 83, France at 83. So they're all a little bit higher than what we're sitting at here in the US. Something like Puerto Rico is right at 80, so they're comparable to us. Cuba sits at 79. Um, that's right around us, where we are here in the US. China's at 77. Peru and Morocco are 77 years of age. Saudi Arabia is 75. Mexico is 75. Our lowest ones are, let's see, I believe it to be like, yeah, your African countries, of course. Chad, Nigeria, they're both sitting at around 55 years of age on average. Um, so you can kind of get an idea of where we're at around the world in terms of, what our life expectancy is. But generally speaking, women in every case have longer lives than men due to a number of reasons, but some of them health related, some of them doctor related. Women go to the doctor more. Women tend to have more resistance to infections. Uh, Women tend to seek treatment faster, as well as jobs too. Women tend to have jobs that are not as unsafe. Men tend to be more firemen, more police officers, more construction workers, in more of the military, and so those, are going to decrease your life expectancy as well when you're at risk with certain jobs. Those that are living to be 100 and beyond, uh, generally speaking, have no health issues at all. Where scientists are increasingly finding evidence that genes play an important role in pushing the lifespan into the 90s and beyond. Uh, in developed countries, we have about 1 in 6,000 supercentenarians who reach 110 or more, um, are only about 1 in 7 million people around the world. There's an old saying that goes something like this: if you live to be 80, it's more likely you live to be 100. There's some science to this, actually. Some people just don't seem to fall ill the way most folks do. Many centenarians are not married, or I'm sorry, not marred by disease. For decades, they seem to ward off afflictions, including dementia, heart disease, hypertension, at least until close to the end of their lives. On average, centenarians can delay disease until about age 93, and then they might start having some issues. The majority of them, of course, are women. 85% of them are women. Um, but there's no one region of the world that appears to have an abundance of centenarians. So it's not necessarily geographical reasons. So the next few slides will go through cellular clock, free radical theory, and hormonal stress theory, but these are some short video clips that you can watch to help you understand these theories a little bit better if you're struggling still. So this idea of the cellular clock theory we got from Leonard Hayflick. He says that's found that cells can divide a maximum of about 75 to 80 times. And as we age, our cells become less capable of dividing. So based on the way cells divide, Hayflick places the upper limit of the human lifespan potential at about 120, maybe 125 years of age. Each time a cell divides, the telomeres become shorter and shorter. So after about 70 or 80 replications, they're dramatically reduced, and then that cell can no longer reproduce. So free radicals are unstable molecules, excuse me, unstable molecules that are missing one or more electrons. The scientific definition of free radicals is very technical, but the main feature that they're missing a molecule so that they try and steal or share one with other molecules. This unstable molecule has no charges and a short life. A human being has up to about 20,000 free radicals. The problem with them is that they attack human cells. This doesn't sound like a good thing, but sometimes it is. Free radicals sometimes team up with the immune system cells to kill bacteria as well as tone muscles. Sometimes free radicals can help improve the function of blood vessels, organs. However, the problem is when free radicals start attacking healthy cells. This can be caused by various factors like heart disease, immune system diseases, cancer. The problem is this process can cause a chain reaction. So when free radicals steal an electron from another molecule, that causes that molecule to become unstable. Do you ever notice how quickly US presidents seem to age? These are before and after photos that reveal how stress can play a role in the aging process. So this falls underneath the hormonal stress theory. It's also known as the neuroendocrine theory of aging, and it suggests that we age the ability of the hypothalamus to regulate hormones in the body. This begins to decline, leading to metabolic problems. This decline is linked to excess of the stress hormone cortisol. So while many of the body's hormones decrease with age, cortisol does not. The more stress we experience, the more cortisol that's released, and then the more hypothalamic damage that occurs. Changes in the hormones have been linked to several metabolic and hormone-related problems that increase with age, such as diabetes, thyroid problems, osteoporosis, as well as hypotension, osteotic hypotension. The nun study that David Snowden did revealed new understandings of Alzheimer's disease. So this was the most ideal scenario for long-term research on disease, to study the nuns, because the women had similar lifestyles, socioeconomic status, access to health care, as well as social support. None of the women had ever been married or had children. This gave them each similar risk for certain cancers and other diseases. And many of the nuns agreed to donate their brains to research after their death, which helped the researchers predict which factors influenced cognition throughout the nun's life. Snowden had access to autobiographies that each of the women had written in their 20s, which allowed him to compare cognitive abilities early in life, as well as to the women's present state. The most confounding variables present in most human studies had been removed, and Snowden and his team had a wealth of information to conduct their study. There's still a lot to learn, of course, about Alzheimer's disease and dementia, but this study really gave a start to understanding it. After you pass the milestone of age 40 in middle adulthood, you'll notice it's more difficult to focus on objects up close. This is because the lens inside the eye begins to lose the ability to change shape. There's a gradual decline in focusing ability. Sometimes holding reading material farther away from your eyes can lead to the need of reading glasses, and sometimes multifocal contact lenses. As you continue to age through your 50s, this becomes more advanced. You'll sometimes notice a change in the eyeglass or contact lens prescription as a result. Cataracts can be considered an age-related eye disease, but is so common these days among seniors that it's classified at times as a normal aging change process. About half of all 65-year-old Americans have some degree of cataract formation in their eyes. As you enter your 70s, the percentage gets higher, but modern cataract surgery is extremely safe and so effective that 100% of vision lost to cataract formation usually is restored. It's often better to remove the cataracts before they're advanced too far. Macular degeneration is another age-related disease that can cause blindness among seniors. According to the National Eye Institute, more than 2 million Americans currently have age-related macular degeneration, and by 2050, this is expected to double to more closer to 5.4 million. Glaucoma increases a risk each decade after 40, about 1% in your 40s and 12% to your 80s chance of glaucoma. We have diabetic retinopathy. More than 10 million Americans over age 40 are known to have diabetes. About 40% have some degree of diabetic retinopathy, which could lead to permanent vision loss. Reduced pupil size is something else that we see. The reaction to light loses some strength. This causes the pupil to become smaller and less responsive to changes in ambient lighting. Most of the time, because of these changes, people in their 60s need 3 times more ambient light for comfortable reading than those in their 20s. Dry eyes. As we age, our body produces fewer tears. This is especially true for women after menopause. Loss of peripheral vision is another part of the aging process. With our eyes, we see the size of our visual field decreasing by approximately 1 to 3 degrees per decade of life. So by the time you reach your 70s and 80s, your peripheral visual field loss is about 20 to 30 degrees. Because of this, it increases the risk of automobile accidents. So you need to be more cautious when driving, have a full range of vision, turn your head and look both ways when approaching intersections. We also have a decreased color vision. Cells in the retina that are responsible for normal color vision decline in sensitivity as we age. In particular, blue colors sometimes appear faded or washed out. So there is no treatment for this. It's just part of the age-related loss color of perception, but it's helpful to be aware of this change in your eyesight. Hearing loss is a common problem caused by noise, aging, disease, and as well as heredity. People with hearing loss find it difficult to have conversations with friends and family. They may have difficulty responding to warnings, hearing doorbells, as well as alarms. Approximately 1 in 3 people between the ages of 65 and 74 have hearing loss, and nearly half of those older than 75 have difficulty hearing. Older people who can't hear well may become depressed. They may withdraw from others because they feel frustrated or embarrassed about not understanding what's being said. A key indicator of signs of hearing loss could be withdrawing from social conversations or social events, thinking that others are mumbling, not understanding when others speak to you, finding it difficult to follow conversations, especially if 2 or more people are talking, asking people to repeat what they've said. I think the biggest indicator that you've probably noticed, even in your own homes, is the volume of the TV. It can be so loud sometimes that others in your household may complain. Hearing loss comes in many forms. It can range from mild to more moderate or even total hearing loss. There's two general categories. Sensory neural hearing loss, which occurs when there's damage to the inner ear or the auditory nerve. This is usually a permanent hearing loss. And then there's conductive. This occurs when sound waves cannot reach the inner ear. So this can also be caused by earwax buildup, which can be fixed in the doctor's office. There's a procedure where they can flush out your ears. Sometimes fluid buildup or a punctured eardrum can sometimes restore this conductive hearing loss. Sudden sensory neural hearing loss or sudden deafness is a rapid loss of hearing. It can happen to a person all at once or over a period of up to 3 days. This would be considered a medical emergency and should be treated immediately. Ringing in the ears or tinnitus is also common in older people. It's typically described as a ringing, but can also sound like a roaring, clicking, hissing, or buzzing. Sometimes it comes and goes. Sometimes it can be heard in one or both ears. It may be loud or soft. It's often the first sign of hearing loss in older adults. Sometimes it's a sign of other health problems, such as high blood pressure, allergies, or can be a side effect of medication. Loud noise is one of the most common causes of hearing loss. So lawnmowers, snowblowers, loud music, especially like your construction workers or factory workers, can contribute to hearing loss or permanent hearing loss as well. A decrease in taste and smell commonly occur with aging. But if you notice these senses, loss of senses suddenly or a significant change in your ability to smell or taste, you should see your doctor immediately. Certain medications or an underlying medical problem could be to blame. Although nothing can be done to reverse this process, it is age-related. There are many ways to make eating more enjoyable and ensure you get the proper nutrition if your taste and smell aren't what they used to be. The tongue has taste buds and taste receptors that allow us to perceive sweet, sour, salty, and bitter. In addition, when we eat, food releases odors that engage the olfactory nerves with the nose. Those aromas combine with the tastes on our tongue to contribute to the overall enjoyment of food. With aging, nerves within the nose tend to degenerate, decreasing the ability to smell and taste. For most people, this is less of a problem. The tongue has more nerves than the nose, so quite a bit of nerve loss would have to occur before you notice a decrease in taste due to problems with taste buds alone. Age-related changes to taste and smell occur gradually over time. Sometimes nasal and sinus problems, allergies, or sinusitis can lead to a decrease in these senses. Dental issues like an abscessed tooth, tooth decay, poor dental hygiene can also interfere with your ability to taste and smell. Cigarette smoking is another common cause for a decrease in taste and smell. In some cases, the loss of these senses could be a bigger underlying, more serious medical concern, such as a neurologic disease like Alzheimer's or Parkinson's in the early stages. For many people, these senses simply fade with age. The loss is permanent. If that's the case, then you have to find ways to make eating more pleasant by eating with other people as much as possible, social events. It's often more enjoyable to eat meals together with other people. Try and experiment with different flavors, like adding seasonings and spices. You just don't want to put too much salt as you age. That excess in sodium could lead to additional health concerns as well. Neuropathy is the biggest problem that we see with the elderly population. It is often linked to diabetes. Generally speaking, elderly have less sensitivity to pain, which sometimes masks the injuries that you can get. Neuropathy can be, it's damage to the nerves, but we often feel it first in hands, fingers, feet, your limbs. It's described as a tingling, numbness, burning, or pain sensation. People have described it as if it feels like their hands are on fire sometimes. It is a permanent loss. there's no cure to it, just treatment to try and manage the pain, or the feelings associated with neuropathy, but it's, damage to the nerves that's irreversible. So like I said, we see this more with diabetic patients, but not all the time, but most of the time that's what we see. Uh, it can be dangerous for elderly, especially when they cook. They could pick up a hot pan off the stove and not realize it's hot, and then all of a sudden they have, burns on their fingers, which for a diabetic is more problematic because they're a slow healer. The other pain that we often see with this age group is lower back pain. And so this is common among most Americans to have some type of lower back pain, um, which is unfortunate because there's not a lot of help that's associated with lower back pain. Oftentimes, it's complained about to physicians. It's actually the second most common complaint that's heard by physicians, primary care physicians. In the U.S., approximately 85% has experienced lower back pain at least one time in their life. So this is usually the lumbar or waist region of the spine, which supports most of the weight of the upper body. Sometimes sprains and strains can occur with lower back pain. This lasts about 2 to 4 weeks on average, and is about 70% of the problems associated with the lower back. There's also degenerative disc disease, DDD. This is fairly common cause, about 10% of acute lower back pain, which also lasts about 2 to 4 weeks. It is usually a consequence of normal aging or less frequently trauma related. The discs lose its ability to cushion forces on the spine, which it makes the individual experience stiffness. Sometimes periodic flare-ups in the lower back can get worse over time. It's best to treat it with non-surgical methods, over-the-counter pain relievers, ibuprofen, naproxen, muscle relaxers sometimes for short-term, on occasion opioids, which is a narcotic drug, can help. Epidural steroid injections can be another treatment for this. Electrical nerve stimulation can also be helpful for DDD, especially when it's associated with inflammation and pain. And then you have more serious things that happen, like a ruptured disc or herniated disc, spinal compression fractures, or spinal stenosis that can be attributing to lower back pain. Sciatica, the sciatica nerve can be painful and relates to the lower back often. And then scoliosis, this is less than 1% of all lower back pain problems. This is related to the curvature of the spine. Normally the spine is aligned in a straight vertical line. Treatment of scoliosis is usually dictated by the degree of the spinal curvature. So sometimes surgery can be considered if the curvature is greater than 40 degrees. Otherwise, a brace sometimes to help with the curvature if it's between 25 to 40 degrees. So there's several choices or treatments out there. Kidney stones can also cause lower back problem. About 1 in every 20 people will develop kidney stones at some point in their life. Usually accompanied by blood in the urine, we see with kidney stones. Most individuals are able to pass them through urine, but very painful process. Otherwise, treatment sometimes can be a little bit more helpful, or narcotics for pain relief. Intakes of fluids to help pass the stone can be encouraged as well. There's often a myth out there that as you age, you're not interested in sex anymore, but that's not necessarily true. Um, Despite these myths and assumptions of society, sexual desire does not necessarily dissipate with age. but the physical and cognitive and psychosocial changes that can occur with the aging may interfere with sexual outcomes. Issues of sexuality with older adults often become a taboo topic. People aren't comfortable talking about them, but there's a need to raise awareness and to have these discussions with um, older adults and still engaging in sex. As men age, testosterone levels decline and change in sexual function are common. There's physiological changes that can include a need for more stimulation to achieve and maintain an erection and orgasm, shorter orgasms, less forceful ejaculation, and less semen ejaculated. There's a longer time that's needed to achieve another erection after ejaculation. Um, so sex isn't necessarily the same as when you're in your 20s, but contrary to the myths, can still be satisfying. Many seniors continue to enjoy their sexuality into their 80s and beyond. A healthy sex life is fulfilling, not only fulfilling, but is also good for other aspects of your life, including physical health as well as self-esteem. Uh, there was research that was done in a study that was published in the New England Journal of Medicine that suggested 31% of men and 20% of women in their 70s and 80s reported that they were still kissing, hugging, and messing around with their partners. 54% of men and 31% of women over age 70 reported that they're still sexually active. A third saying that they have sex at least twice a month. So there was about just over 3,000 that were surveyed for this of men and women. So uh, the it's more common for those that stay sexually active if they're uh, living together, right? If they're married or if they are cohabitating, it tends to be when we see more activity and more increase in sexual activity uh, in our older adults. So heart disease is still the top cause of death, and this has not changed. However, more women are now dying of heart disease. Um, there is preventative care that can help, as well as advancements in medications and procedures that have been done. The CDC reports that 80% of heart disease deaths are attributable to lifestyle factors. So, changing your diet, activity, health management could prevent many deaths, but it's especially hard for older adults to implement lifestyle changes. So, support can definitely help with that. Monitoring vital signs at home, keeping up with regular appointments. Cancer is still retained the same place on the list at number 2. The actual numbers have increased significantly, but as people live longer, this is somewhat inevitable. But it's also a good sign that people are living longer, even after a cancer diagnosis. Uh, as with heart disease, lifestyle sometimes plays a role. So, even after you've been diagnosed, eating a healthy diet, increasing physical activity, stop smoking, reducing alcohol intake can all help. Chronic lower respiratory diseases is ranked at number 3 currently. Um, most of us think of heart attacks, cancers, and strokes, but COPD is often related to smoking and environmental causes and tends to be a chronic illness. Sometimes medications, inhalers, steroids, oxygen therapy can be helpful with chronic lower respiratory diseases such as COPD. Alzheimer's disease is ranking at number 5 currently. Back in 1980, it didn't even make the top 10. So this has changed drastically over the years. Injuries, falls actually make up 55% of fatal injury or deaths. So accidents here would be, falling at number 7 with our injuries and as well as motor vehicle accidents. Um, Motor vehicle accidents come secondary to our falls. So that is a concern as we get older as well. Diabetes ranks up here too. Um, as a potentially fatal health issue. Circulation and the immune system become compromised. So it's essential with anyone with diabetes to monitor your blood sugar levels as well as your vital signs. Um, Even minor injuries can become fatal for a diabetic. Like I mentioned earlier with the neuropathy and the burns, it can be hard for them to heal with the lack of circulation or circulation problems and nerve damage. So it's important to make sure that there's good nutritional support, proper medication management, as well as support from their loved ones. Arthritis affects 1 in 5 adults and continues to be the most common cause of disability. Interventions can be like increased physical activity, self-management and education, weight loss among overweight or obese adults. Uh, Arthritis can develop at any age, but we see it more often in our elderly population. In the US, we have about 5.3 million people that are age 50 or older that have osteoporosis. Most are women, but just under a million are men. We have about 34 million people, including 12 million men, that have a low bone mass. This is going to put them at an increased risk for developing osteoporosis. Half of all women and as many as 1 in 4 men age 50 and older will have an osteoporosis related fracture sometime in their lifetime. Um, I mentioned like the lower back pain or chronic back pain earlier. 15 to 20% of the population have some type of protracted back pain. 2 to 8% have chronic back pain that lasts more than 3 months. 3 to 4% is temporarily disabled due to back pain, and 1% is considered to be permanently disabled. We as Americans spend about $50 billion each year on lower back pain. This is the second leading cause of lost time at work, the third most common reason to undergo a surgical procedure, and the fifth most frequent cause of hospitalization. So if you took Intro to Psych, which I believe all of you have if you're in lifespan, but it may have been some time since you had it, you would remember some of these terms from there. This is all related to memory, selective attention, divided attention, and sustained attention. So these are just basic definitions, but we sometimes see more problems with attention and memory as we age, right? Not related to Alzheimer's and dementia, but just changes in it. We call it divided attention all the time, but really, um, we look at this as multitasking, but it's really divided attention is what I meant to say. So when we're multitasking, we're bouncing between a bunch of different things at one time, but really what we're doing is we're dividing our attention among different things, which means we're only really paying attention to one thing at a time, so we're not fully paying attention to everything that it is that we're doing. And as adults, older adults, it can be more difficult to do this, to multitask, to divide our attention and still focus on a bunch of different things at one time. There's been a lot of studies done on memory, but one study, it involved 129 younger and older adults. So if they were younger, they were averaging around age 19 or so. And the older adults averaged around age 69. And it did show that younger adults are better at explicit learning, but older adults were better at implicit learning. So implicit learning or memory is our unconscious memory, which influences behavior without our awareness. So older adults showed better implicit than explicit memory. Um, and so we continue to study that. Episodic memory declines earlier than semantic. Semantic is like general information or just knowledge that we have about things. Episodic are episodes of your life. So remembering like important events that have happened in your life. So we have also noticed that health, as well as education and socioeconomic status, play a role in memory declining or not declining. So we see more of a memory decline in our lower income and poverty areas, less educated, than we do in our higher socioeconomic areas and higher educated people. We generally think about retirement around age 65, but that does vary. We do have a lot more older adults that are working today than we were back in our 50s and 60s, 1950s and 1960s. There's still a small portion of adults that are age 70 or older that are still in the workforce. Um, with the shift in Social Security, that has required people to work a little bit longer. Retirement, though, is a major transition of late adulthood. The retired person must eventually accept a leisurely life, whether they want it or not. He or she must also continue to live in a worker's world in which retirees are viewed as spent or devalued sometimes. There's a psychological impact of retirement on older adults that can be significant. They deal sometimes with feelings of depression, uselessness, low self esteem. People who are in good health, better educated, and have fewer or no financial worries, have adequate family and social networks, are usually satisfied with life, often look forward to retirement. Retirees may choose to spend their free time volunteering for charities, traveling, taking classes, or engaging in hobbies. The least satisfied retirees are those who never planned for retirement, have limited income, have few or no extracurricular activities, and those who stay home day after day with nothing substantial to occupy their time. It's important to plan for retirement. Um, there's a disengagement theory that proposes that older adults withdraw physical, psychologically, as well as social. They sometimes have less physical energy, which causes adults to have a slower pace, diminished interest in the world. Uh, Social interactions and investments become fewer in this stage. Sometimes withdrawal or acts of withdrawal are reciprocated by society. An example of this is mandatory retirement, which removes individuals from the workforce, which can heighten all three of these levels in the disengagement theory. Uh, there are some flaws in this theory, though, including society removing opportunities for aging adults and then blaming them for withdrawing. That's not necessarily true. In modern society, most individuals remain active and engaged throughout their lifespan. Retirement, is just a part of late adulthood, but leaving that stability and routine that work has provided them can be difficult. So the choice to retire is not always straightforward. Sometimes burnout, declining health, you want more time with your family, or just to enjoy leisure activities. Some individuals retire as early as 55 or 60. Others work well into their late adulthood years. Usually finances has a lot to do with retirement age, pensions as well as Social Security income. Depression is not part of the normal aging process for our elderly. It can be difficult to recognize symptoms because sometimes the symptoms are different than younger people. For some older adults with depression, sadness is not the main symptoms. There might be less obvious symptoms of depression, or they're not willing to talk about their feelings. Therefore, doctors are not as likely to recognize that the patient has some depression. But older adults that feel depressed sometimes feel more tired, have trouble sleeping, they're grumpy, they're irritable. Sometimes confusion or attention problems caused by depression can look like Alzheimer's or other brain disorders. Medical conditions like heart disease, strokes, cancer can cause depressive symptoms. Sometimes medications with side effects can lead to depression. Um, we have major depressive disorder, uh, persistent depressive disorder. Sometimes genes, personal history, brain chemistry, and stress can play a role in depression. Vascular depression are for older adults who experience depression for the first time later on in life and have no previous history of depression. So it can also be difficult to gauge because of that. So treatment should be sought, talk to a doctor, especially if the symptoms have consisted for 2 weeks or longer. There's a lot of money being poured into Alzheimer's disease right now. but we still don't fully understand what causes it. And there's probably not one single cause, but several factors that affect each person a little bit differently. Changes in the brain can begin years before the symptoms appear. Family history, sometimes genetics, some researchers believe play a role in Alzheimer's disease. The number is projected to triple, nearly triple to 14 million people by 2060. Um, Younger people, we call it early onset Alzheimer's, can get it, but it's not very common. Symptoms of the disease first appear usually around the age 60, and the risk increases with age. In 2014, we had as many as 5 million Americans that were living with Alzheimer's. It is a progressive disease, beginning with mild memory loss, possibly leading to the loss of the ability to carry on a conversation and respond to the environment. It involves part of the brain that can control thought, memory, and language, and seriously affect the person's ability to carry out daily activities. Early detection is always key. Alzheimer's is not a part of the normal aging process. Sometimes signs of Alzheimer's are like trouble handling money and paying bills, uh, difficulty completing familiar tasks at home, poor judgment, misplacing things, changes in mood, personality, or behavior. Treatment addresses different areas, helping people maintain mental function, managing the behavioral symptoms, and trying to slow or delay the symptoms. Uh, Different sources, give you different stats sometimes, but um, it is one of the top 10 leading causes, as I mentioned earlier. I believe I said it was number 5 on the list. Most people willingly provide care to their loved ones and friends with Alzheimer's disease, but this can become difficult over time and overwhelming. Each day brings new challenges as the disease progresses and gets worse. Oftentimes people need more intensive care as a result of the Alzheimer's disease.